Hi, this is Paul Wise. Welcome to the Lawn Vet video series. Today I'm going to be demonstrating how to administer subcutaneous fluid therapy to your cat. This is something which you might need to do, for example, if your cat has kidney failure. It's by far the most common reason why it would ask you to do it, and it's kind of the equivalent of a dialysis, really. So this is how we go about it. You'll have been given some equipment, which we've got on the table in front of us, a bag of fluid, typically a 500ml bag, a giving set and a needle. So we're just going to demonstrate how to put the equipment together. So first thing we need to do is get into the bag. That usually requires a little trim with a pair of scissors because the bags are quite tough. There is a peel away section, it just doesn't seem to peel away very well. So I'm just going to cut my way into the bag here. And take the bag out. You'll notice at the end of the bag there are two ports. One's for injecting into the bag, so that's the injection port with a little rubber bung there. You're not going to be using that. You're going to be using this port here, which is the one we put the giving set into. So just moving across to the giving set, and to turn around, we need to peel that open. And you'll notice, and we will just take this out at this point, you'll notice that we've got a reservoir end, a control device with a little wheel, which I'm just going to turn off. So we do that by just moving the wheel down, and then this other end here, which is where we're going to put the needle. So to start off with, we take the reservoir end, remove the cover, and we've got a spike there which is sharp. Try not to touch it because you need to maintain the sterility. Take the bag, this end here needs to come off, and we do that with a twisting motion, and it comes off quite easily. We're going to insert the spike into the bag. You need to be a little bit careful when we do that. Make sure that we maintain the sterility, and make sure you don't push the spike through the wall of the bag. If you do, it'll start to leak and you'll need to start again. So just push that in here. A little bit of force required. Okay, so we've now got the giving set in the bag. We're just going to prime it. So hold the bag the way up, and we'll squeeze some of the air that's in this out. So it's about half full. Now I'm going to move over to the sink. And I'm just going to run a little bit of this fluid out so we get rid of the air that is in the tubing. So we're just going to advance the wheel back up, turn it on, and the fluid will run out. I'm just going to turn it off there. Now, when you're giving fluids to cats, they'd like them to be at body temperature. So we've actually filled the sink up with water at body temperature, i.e. 38 degrees. I'm just going to pop this bag in here now to warm up. Okay, so we've now got the bag of fluid. We've taken out the sink. It's warmed up to body temperature, around about 37 degrees centigrade. We're just going to weigh the bag. And you can see it weighs 534 grams. So that's 500 mils of fluid, because a mil weighs 1 gram, plus obviously the bag and extraneous bits and bobs. So the number of cc's you will give will be the same weight in grams. So if we're going to give 100 mils of fluid, it will be 100 grams of weight coming out of the bag. So now we know that weight, we're just going to memorise that and pop the bag up onto, in this case, a drip set. But at home you could use, well, people tend to hang it over doors and things like that, or picture hooks. Something like that banged into the wall. I'm just going to put a needle onto the end of the giving set. So I'm just going to move this little rubber bung, peel the needle out, and this screws on. So it just screws on like that. And we take it out, and then we're going to insert the needle into the patient, just underneath the skin. So we do that by tenting the skin up and insert it in up to the hilt. And then we turn the bag on here using the wheel. We just turn it up, and you can see it's dripping. And basically we wait then until the required volume of fluid has gone in. Okay, so it looks like we've given the required amount of fluid. I'm just going to check the weight of the bag. It should be about 100 grams lighter, which it is. So now I'm just going to turn off the administration set here by winding that blue wheel down. And then we remove the needle and just put the cover back on. Be careful when you do that. Okay, that's fine. Now we will just notice here, just move our little friend into the middle of the table for a second. The fluid that's beginning under the skin, we've got a bit of a hump here at the moment. That's going to gravitate down. It's probably going to end up down near an elbow. So often you'll notice a swelling in this area a few hours after you've done the fluid. That's nothing to worry about. That fluid will be absorbed over the next 24-36 hours. As always, if having watched this video you have any questions, or if you encounter any difficulties performing the procedure, then please phone or email the surgery. We're here to personally help give you the very best advice and treatment possible for your much loved pet. Thanks for watching. Any feedback regarding this video will be very much appreciated.